Welcome to the Just Ingredients podcast. I'm Cara Lynn, and here we talk all things nourishing to the mind, body, and soul. This is a place where you can find just good ingredients to life. Welcome back to the show, everyone. Today, I'm excited to welcome Dr. Robert Whitfield to the podcast. He's a board-certified plastic surgeon specializing in breast explant procedures and holistic recovery. Based in Austin, Texas, Dr. Whitfield is known for his innovative approach to healing and hosts the Breast Explant Surgery and Recovery podcast. We're looking forward to learning from you today. I have so many questions for you. Welcome to the show, Dr. Whitfield.
Thanks for having me. I really appreciate it.
Before we begin, will you just tell me or tell my listeners a little bit about yourself, your background, how you got started into this?
Yeah, sure. So my training is in plastic surgery with an emphasis on oncologic reconstruction. So the majority of my career, I was taking care of patients with breast cancer, head and neck cancer, sarcomas. Maybe they were in a accident and had a need for reconstructive surgery. So I would help other surgeons with those. And just by virtue of the prevalence of breast cancer in, our population, I did more and more breast reconstruction. And it was a breast cancer patient who came to me in 2016 who actually wanted to go flat and have their breast implant reconstruction removed. And so I did that. We did a capsulectomy for that patient, and ultimately that showed that the patient had an E. coli infection. That was concerning. That patient then, I believe, put me on a group or a directory, and patients then started calling my office asking for explant surgery.
So interesting. Okay, so I'm curious because breast explants is a huge trendy topic right now. And so I have so many questions because people ask me on a daily basis, followers ask, like what I know about it, if I know people to recommend, things like that. And so
Sure.
let's just start at the basics though. Are breast explants needed for every person, or is it just that some have a reaction or some get an infection or some it affects their health?
Sure. So in 2018, in the run-up to the breast implant hearings of 2019, we were trying to kind of wrap our heads around what is all the meaning through just the social media environment. It was becoming more and more prominent with what I just told you. I would see these patients come in and they'd have complaints, and they'd be pretty varied complaints. There'd be problems with memory loss, termed brain fog. There'd be problems with fatigue, a lot of chronic inflammatory symptoms, a lot of problems with digestion, pain in muscles and joints, and sometimes they'd have shortness of breath and palpitations. And it was a really broad number of symptoms. So that really didn't fill, kind of the gaps in what was going on. In 2019, there were hearings held in Bethesda at the FDA, and I was the president-elect of the Research Foundation for the Aesthetic Society. And I testified right after a woman who had an incomplete capsulectomy and ultimately had been left with breast implant-associated anaplastic large cell lymphoma on her rib cage. And we obviously don't want to ever have any cases like that. So there's a lot of work that's been done with breast implant-associated anaplastic large cell lymphoma, but there hadn't been to date that much research done about breast implant illness. So as president, I wanted to help fund research for that. So we were able to fund some research. And since 2019, honestly, there's 194 papers that have been written and published in the scientific literature. I think the jury's still out on exactly what's going on in every single instance, but we know in those cases that have bacterial contamination. And bacterial contamination, for everybody listening, so we're on the same page, everybody understands. If you get a cut and your skin gets infected, or if you get a cold if you get a urinary tract infection. Like there's a host of ways that bacteria get into our body, and usually our body does a great job of eliminating that threat and taking care of it. That's what our immune system does. In those instances where we have a hip implant, a knee implant, a breast implant, a cardiac implant, all whatever the implant is, the bacteria that's in the bloodstream can actually get attached to the implant and stick to it. And it's very hard for our immune system then to take care of this bacterial contamination. And many of them produce material that makes it harder and harder for the immune system to take care of it. And they form a biofilm. So these are like communities of bacteria. So last year, we published a paper that showed in 600 explant scar tissue specimens from patients, 29% had bacterial contamination. And so that typically happens throughout life. Just like I said, it's not something that typically happens in the operating room because there's all sorts of precautions taken in operating rooms for hip surgery and knee surgery and breast implant surgery, any kind of reconstructive surgery. So this is typically throughout the course of our life. We get exposed to different things environmentally, etc. And so the thing for us when I think about, the bacterial contamination and what can it do, the latest research shows that interaction between the bacteria and the fatty acids in the breast can lead to development of something called oxylipin 10 ho. So think of it as something that stimulates the immune system. And then that can be responsible for those symptoms I listed. Things like
Mm.
brain fog or things like fatigue or things like joint pain and muscle pain, because it's a process it's stimulated by, in these cases, the bacterial contamination that helps that molecule get produced. And the audience, when our cells work hard, it creates oxidative stress. It's like working out hard, and then your cells have to recover. And if they can't, and these products are produced in such excess that we can't detoxify them or get rid of them, then we become, as you would expect, more symptomatic. So that's probably the best scientific, explanation currently. And then it becomes like after explant, what is the situation? We've worked diligently on looking at genetics, which I know you want to ask me about. We've looked at toxicity burden testing, gut health, things in our diets that can be triggers. Um, we've looked at hormones, and it's still, largely it's difficult to follow the patients other than, you know, on their symptoms and then repeat tox testing. But there's a paper was recently published out of Netherlands looking at something called fibroblast growth factor 19, which shows promise for something that you could follow long term and watch it decrease over time after explant. So I think the research is getting better and better. But once again, since those hearings in 2019 where I testified, 194 papers have been published just about breast implant illness.
Wow. Okay, so I'm curious though, because when you say like brain fog or joint pain, things like that, that to someone who has implants, that easily could be that their hormones are off or that they've got some gut issue going on. It could be a plethora of issues, fatigue and the things causing inflammation basically. So how does someone know it's actually the breast implant? Is there a way to test for that bacterial infection or no?
Not before surgery, not currently. So that oxylipin product it was found in a research study. It's not a commercially available test. So, and that would only represent in those, roughly third of the patients that had that problem, that biomarker would be elevated if in fact that was the issue. So it's one where you need to make sure from a medical standpoint, the patients have had those issues to the best of their ability optimized. Now we have patients come in with a whole, you know, fistful of paperwork from every, doctor they've seen, the GI doctor and the rheumatologist. And, most of the people that come to see me now, I've went through extensive workups elsewhere and they're kind of at what they consider the end of their, um, rope with this, you know, problem. So I look at breast implant illness as you just said, a chronic inflammatory process of which implant is playing a role. And you don't know how much or how little of a role that implant is playing, but just if you follow the scientific literature and you look at, basically what's found after explant, there's always typically chronic inflammation found in the tissues around it. And then from a symptom inventory standpoint, our patients, clinically do better. Now we have a pretty aggressive, program when it comes to helping them with toxicity and then helping them, get better through a series of holistic treatments. It's a little bit more complex than, or it's quite a bit more complex than somebody just explanting and magically they feel better. I've had patients who go on and report that one patient, Lauren Bostick, of the Skinny Confidential podcast, was my patient. And she had a real problem with heavy metals, where we felt that she was causing leaching by doing extreme sessions in her sauna. She had a sauna that would go up to 212 Fahrenheit. And she would get in that an hour, hour and a half at a time, multiple times a week, and she felt worse afterwards. So I just have people, exercise caution. If they feel bad after a sauna session, that's not a good thing with the breast implant in place, because I can't guide you on the safety of that. No one can, because there's no study showing safety and efficacy of use of a sauna and a breast implant.
Hmm. Okay, so you said something that made me remember a conversation I just recently had. You said you can't just take them out and then magically you'll feel better all the time. And so I had a lady come to me who said, I had my breast implants taken out. I don't feel any better. And I was like, well, what are you eating and what are your lifestyle factors? And have you had your hormones checked? And, the list went on and on. She hadn't done any of that. She just was like, no,
Sure.
I
Yeah.
felt crappy. So I went and took them out. So they need to do all the other tests and things or work on their diet and things
Right.
before they just go take them out, correct?
Yeah, we don't advocate. In fact, you can't actually have any form of surgery with me without running our program. So the book I wrote behind me, Sharp, is about our methodology looking at genomics, toxicity burden, gut health, hormone balance, triggers in diet, um, metabolomics. Like you have a standard Western workup where you used to have surgery and you may need to get your blood count checked. You may need, depending on your age, EKGs, so they make sure your heart rhythm is fine. When I was training, they wanted to look at a chest X-ray all the time, which was unnecessary, especially in younger patients. They were just kind of the standard screening tools, but everybody who comes to see me has already had so much work done either by their own doctors or through specialists that um, the things I'm working on are more, I guess, if you want to say, genetic based, more functional based, more environmental toxin based, so that we have a better idea. A lot of folks live in environments or work in environments where they may get exposed to either chemicals. Like I have a lot of people that come from the military and they get exposed to all sorts of chemicals. People who grew up in an agricultural area would have been exposed to different chemicals from the spray that's used on the crops. If you live in places where there's a lot of insects, no state in particular, I will say, but I have a lot of people from this coastal state come and they have a lot of chemicals in their system. And they tell us that in their neighborhoods, um, the their neighborhood is sprayed for insects because it's such a difficult problem there. Now, so this is more environmental pressure than anybody would normally be capable of dealing with. And then, one of the questions that was sent to me that you were interested in was talking about MTHFR and do I see more of a problem with that in my patient population? Well, the short answer is yes. MTHFR, I have it. And, basically if we just say like 40 to 50% of the population has it, but if you're just, niching down into the patients I see, typically they do have a problem with methylation and MTHFR is one of the genes responsible for that.
Okay, so I have 2 questions for you. Let's go back to the environmental toxins. So why are environmental toxins playing a role in this whole thing? Are you saying that the environmental toxins are making people sicker, and so then their immune system can't handle those toxins on top of the bacterial infection with the implants?
So, if you take someone who has chronic inflammatory symptoms and you do a tox test on them and they have a lot of chemicals and things in their system, they're going to have the same types of symptoms.
Oh, gotcha.
So, if you add somebody who's having trouble with an implant, whether it's chronically inflamed or infected or what have you, you're just making that situation more complicated for the patient. Each person only has a set of genes they inherited from their parents to give them the ability to detoxify anything. So if it reaches a certain capacity and then it's exceeded, you become more and more inflamed chronically and more symptomatic.
So the environmental toxins are contributing to people's inflammation.
Sure, it's just like eating a crappy diet.
Okay, so then back to the MTHFR gene because I have it as well. I know a lot of people that have it. And so they just have a harder time detoxing. And so that's what you're saying is contributing to the inflammation or other parts.
Right. So if you already have a difficult time with coping with inflammation, so you get sick and you recover, but it takes you just a little bit longer. And you may feel fine, but maybe you still have a cold. Maybe that's how it manifests. Or maybe you work out hard and instead of being sore for a day, you're sore for 3 or 4 days. And then you can work out again. So if that's already an issue for you and something else is taxing your ability to, cope from an immune standpoint or from a detox standpoint, once again, you can only handle so many things. And then once capacity is exceeded, that's when people become symptomatic. And the symptoms associated with chronic inflammation are pretty uniform across disease states. We just happen to be adding a mechanic, this is a medical device added to an already complicated situation. So I'm not trying to parse out any of them. This just happens to be the situation I get faced
Let's talk about those dealing with breast cancer because my sister was one of those, had to have a double mastectomy.
with.
And so, what are their choices? Is it purely the implants or nothing at all? Or are there more natural ways to do things rather than just implants?
Oh, well, sure. There's autologous reconstruction is what you're asking about. So that's just using your own tissue. So the patients, if they want to have their own tissue as a tissue reconstruction, that's been around for the tram flap has been around since the 80s. Really, that's a very it's a useful tool for reconstruction that utilizes the lower abdominal tissue, and it doesn't require a really sophisticated skill set to do. I did microsurgery for a living for my career, and that does require an operating room microscope and specific staff because you're actually cutting the blood vessels and then hooking them back together to the blood vessels underneath the breastbone or the sternum. And so that's called a DIP preflap reconstruction. So it's the same type of tissue. It's just you're leaving the muscles alone. So the six pack muscle, the rectus muscle is just left in place. And then you're removing just the skin and fat with the blood vessels. So that's your own tissue. You would need to find someone in your area who does microsurgery. And to kind of explain it this way, I live in Texas. So the entire country of Spain can fit into Texas. So in our country, uh, just due to its sheer size, you can get into, um, you know, small community-based hospitals very quickly. So I'm in Austin, and Austin is not a huge community either. And once you get away from larger communities, your ability to do some of these more complex reconstructions will diminish because of staffing and equipment. I had a special set of instruments. We had all these qualified technicians and nurses to take care of the patients. I had all the instrumentation in the operating rooms, and that's always been my environment. In a smaller community-based hospital, if you, like your friend said, went and got a mastectomy, she would have most likely been offered an implant-based reconstruction because that's what they can do right there for her. And then she can remain in her community. If the plastic surgeon explained all the options, then and she chose like, hey, I would like to go explore that with Dr. Whitfield or one of his colleagues, then she would have to travel away from, her community, which in our country is not uncommon just because of its sheer size. But the most common form of breast reconstruction in the United States is always going to be an implant-based reconstruction, just by what I just said, because it's the most available. Everybody who's, trained in plastic surgery should be able to accommodate that need for the patients in their community-based hospital settings.
Yeah, you don't really hear very often of ones doing it with their own breast tissue, and so I'm curious why there's so many doctors doing, the implants, but not doing with the own breast tissue. Is it just they're not
So
trained in
it
it?
requires extra training. Yeah.
Oh, okay.
Yeah. So I
Make
trained for 6 years in general surgery, 2 years in plastics, and a year of just microsurgery. So I did 9 years. The shortest route you could do to do what I just said would be 7 typically. And so, you typically would go to and find those people in a cancer center or a teaching center. Some sophisticated, private groups have all of that, but you just have to, in your area that you're in, search, you know, DIP breast reconstruction near me or microvascular breast reconstruction near me. And then those people will pop up, but you're not going to find that in a really super small area.
Okay, makes sense. Thank you.
Hmm.
Okay, so let's go back to explants.
Hmm.
So we talked about the mastectomies. We'll move to explants. So, what are the first steps you would recommend though for a safe and effective explant process to women that are listening?
Yeah. So if we have folks who have done their due diligence and feel like this is the step that they want to take. So for everybody listening, I don't tell anybody they need an explant. Let's be perfectly clear. I don't tell anybody to have an explant. That's something that the patient arrives at, typically on their own after exhausting every option, because no one wants to come to Austin and visit me and have an explant. A lot of people do.
I was gonna say a
Uh,
lot of people do, and you're busy.
yeah, the point being is, like, we have a program in place to help people, fill in the gaps, basically. We've talked a little bit about genetics. I think that's super important for people to understand, because if they don't detox well and they have children, like I have a daughter who doesn't detox well. So, in general, knowing that information helps you and creates, if you will, a way to navigate that so you understand it better. And then we look at toxicity burden because I grew up in a place with bad groundwater, and I drank out of a hose as a kid, because my dad always was like, come wash the car with me. And he drank out of a hose. I did. So I had a lot of arsenic in my system. Well, that's a common groundwater contaminant. And then you may have glyphosates, because that's a common herbicide used. It's Roundup, basically. And, like I said, if you grew up near these other places, like say you grew up near a golf course, in the early 2000s, um, there was a chemical called atrazine that's now been kind of excluded from being sprayed on theirs, but it really disrupts your endocrine and nervous systems. And that was a common chemical. I have many patients who have lived their entire lives, they bought their homes on golf courses, and because of the time they spent there, they have that chemical in their system. So we look for all those, because we don't want to hear what you said earlier, where someone explants and then they just don't feel better. So the fact that there's a workup that we can do to help highlight some things that will really help. And once again, um, everybody can actually now take advantage and just run my program remotely. We have a remote way to run the program, remote detox, for folks who don't want to explant, who timing's an issue. So not everybody's going to get there, and we just want to help people. I want to meet people where they are. Like I said, there are people who are going to probably benefit from just running the program we have in place and not ever get to explant because they feel better. So maybe they do things to clean up their diet, identify things in their environment, start eliminating those, and really start feeling better. So that boils back down to what I said earlier, like those folks have genetics that favors better detox. My patients who have the most difficult time have really limited detox capability genetically. And sometimes they have a lot of hormonal problems with high estrogen, endometriosis, PCOS. All of that is a bad mixture. When I hear those stories, those are some of my most challenging patients. They have the most difficulty. They suffer from the most symptoms.
That makes sense. Um, but again, some issues of PCOS and hormonal issues and things can be taken care of without an explant.
100%. Yeah.
Well, and I love that you have a program to help people, that you aren't just teaching to everybody, "Oh, everybody needs an explant." I love that you're teaching them the holistic route of diet and lifestyle factors and things like that. And so if someone's listening, where can they grab that program or get started with that?
Yeah, so the book is sharp, and basically, I've done shows about it, but everybody listening needs to understand, like, this is more about helping everybody where they are. I don't need to and can't operate on everybody. And, there's 2.2 million implants placed worldwide annually.
Wow.
So if we think that is really the crux of this, then you've got 20 to 40 million people who could have this, situation develop over time. And, we don't see that kind of number. So
Okay.
there's a lot of things you can do, obviously, that help you. And we feel programmatically, by patients going through our program, we feel like we have things in place that can help people right now wherever they are. Like if they're just trying to get feeling better, we have something for that. We curated a bunch of supplements to really help based on the genetic results of our patients because we want to support their immune system, help their detox capability. And then I do have a group of folks who are just devoted now to doing group kind of detox to help patients that we know, you know, say for instance, we're dealing with a tox test that's not great. You can start working on that. I have patients that take 6 months, sometimes a couple years to get to me because of life. It gets in the way. And there's no reason why you can't start, lowering inflammation starting today.
I love everything that you're saying. And I love that you're saying that there are other options because on social media, there are some groups that are like, how dare you get implants? How dare you not get yours taken out? How dare, a lot of shaming of women that do want to get implants.
We live in a weird time. That's just the way stuff is. I mean, there's always going to be polarity, and nothing happens on either end of the spectrum. Most things happen in the middle. So like I said, we're trying to meet people wherever they are to help them. I didn't design programs and put all this, work in to not help as many people as we can. We're not trying to discriminate and say that every person has to have surgery. In some patients, in certainly others, other situations, it's important for them to start working on, like you mentioned diet earlier. Diet is probably outside of sleep, diet is the thing that people lack the most education about. Like the things that we need to eat, cutting out really ultra processed foods with a bunch of added sugar or a bunch of additives, preservatives. Those things are just, I mean, try to eat real food. I know that I don't want to sound like a broken record here. I don't care what diet you follow. Just try to eat food. That means it doesn't come out of a package or a box, something that's grown, and then you eat that. Drink to the best of your ability filtered water out of ceramic or glass or stainless, not plastic, because you want to decrease your exposure to microplastics, bisphenols, phthalates, all the things that are in plastics, because that affects a woman's endocrine system and affects your hormones. So you want to do everything you can to get yourself, feeling better by one, just limiting your overall exposures. If you start doing that, you'll start feeling better. It's not a matter of if, it's just when will that, happen.
Yeah, I try to teach that all the time that it's your diet and just eat real food. food out there is made to, nourish the body, but you have to actually eat the food, not the fake stuff. So
Correct.
let's take a quick break to hear from our show sponsor. Spring is the perfect time to jump into your annual deep cleaning, but many of the products on the market we use to clean our homes include ingredients that can contribute to chronic respiratory problems, headaches, and allergic reactions. That's why I use Branch Basics. Free of endocrine disruptors and harmful preservatives, it's safe for the whole family, even your pets. If you suffer from eczema, allergies, or asthma, or just want a great non-toxic option, make the switch to Branch Basics. Their premium starter kit provides you with everything you need to replace all of your toxic cleaning products and laundry detergent in your home. Plus, once you run out, the only thing you need to repurchase is the concentrate and oxygen boost. Save 15% on your starter kit or hand soap with code JUSTINGREDIENTS15. That's JUSTINGREDIENTS15 at branchbasics.com. Now back to the show. So I'm curious though, because you went through medical school, obviously, to become a plastic surgeon, and a lot of doctors that I talk to that have gone the Western medical route don't know about, diet and lifestyle factors and microplastics and all these things. And so what led you to research all of this?
Well, everybody who operates for a living as a surgeon should understand nutrition. I don't think that's complicated. So, understanding macronutrients is not complex at all if you're a surgeon. There's certain protein requirements that help people recover. We emphasize that greatly in our discussions with patients, but I am a non-celiac gluten sensitive person. So, my own journey looking at genetics started many, many years ago to figure out why I didn't feel well. And then my daughter is not celiac, but very close in terms of how she behaves. So we've been a gluten-free, household for over a decade, probably, and trying to be careful. My wife has always taken the lead about, trying to get the best sourced foods. And yeah, I don't think any of that's complicated. Just trying to be careful about, for your children's sake, not exposing them to a bunch of different environmental toxins, trying to be careful with, your something as simple as your detergent. But for women, especially, and I tell my daughter this all the time, you have to be extremely critical of the things you put on your skin because women get exposed to all sorts of things through products and skincare products. If you have one that well, you should put them all just through the environmental working group to see if they've been looked at. And if they haven't, you probably just shouldn't buy it. Just don't do that. That would be the best advice.
I love that you're talking about all that. That's what I try to teach on my platform. So I love that. So, talking though about recovery, you mentioned that. Let's talk about recovery from an explant. So, what I'm sure you probably have some natural, holistic ideas or helps or tips to give people when they recover. Is that true? Or how is the recovery process like?
Yeah. So the people who come to Austin, so if you're in the country, I have people stay here about a week. And if you're out of the country, people stay, 2 to 4 weeks normally, but just due to the flights and all the time changes and things, try to make it easier. But the reason I have 25, I think, full-time employees now, and basically they support the patients after surgery. So the patient will come here. I operated all day yesterday. Every patient from yesterday is here and they're getting hyperbaric oxygen therapy. And we have these wonderful lymphatic massage devices from New Zealand called Flowpresso. And we have red light therapy and we have nano D therapy. So we have things that, you know, will, if you want to say promote healing, that's great. But you're trying to reduce swelling because that really gives people discomfort. And if you can get fluid moving quickly out of the tissues and that will help you feel better probably the quickest. We don't really want people taking a bunch of extra medications. We have everything if needed, but we're trying to get you in and get you feeling better as fast as possible. Oxygen always helps with healing, of course. Lymphatic massage is your body's filtration system being enhanced. So like that all makes sense. And then we use red light. Red light is great to lower inflammation, helps balance out and improve, hormone levels. And then Nano V helps with protein. I, there's anything I can do outside of diet, which I put people on a gluten-free, dairy-free diet with about a gram of protein per pound of body weight initially, and that's hard for patients who typically don't get enough protein in their diets in general, and my vegan and vegetarian patients, just because that's not a big staple of their diets. We have a pea protein that we recommend in those instances, and in general, but once again, I don't care what diet you follow. You just have to get enough protein in your diet, and you have to sleep enough. So you got to sleep 7 to 9 hours. You can't be getting up and go to the bathroom a bunch of times. You got to get enough depth and quality of sleep and sleep cycles to recover, because that's when all the magic happens in terms of recovery.
And so for an explant surgery, how long is a typical recovery?
If we are doing, it depends on your muscle. If you're doing work that doesn't involve the muscle, it's a 1 to 2 week. But in the United States, most of the implants were placed behind the muscle since the 90s, really. And it's really what you have to do with the muscle that kind of dictates how long somebody takes to really recover. People are up walking around doing everything the next day. It's just how much muscle work has to be done to help repair what was done initially in surgery.
Okay, so I'm curious because what you talked about, the red light and lymphatic suits, things like that, they sound amazing. And I feel like those are things we should do after any type of surgery or almost any type of surgery.
I think they make sense. I incorporate them in my program because I feel like, one, they will help everybody recover faster. And two, it goes back to our country. Like, you may be able to get all these things, but they're all at different places. I just bring them all into my clinic so that they're here. Ease of access, ease of use. And that's
Which
what I want.
which is incredible. You say it doesn't sound novel or anything, new and exciting, but this is a new concept to a lot of people. A lot of people don't go do those modalities for healing or recovery.
Right. I mean, it's not novel to us. We've been doing it for several years, but just in general, conceptually, lymphatic massage always helps. Like it's like having, a great recovery spa all wrapped into one.
Yeah, that's amazing. Okay, so if someone is listening to this podcast and they are unsure about keeping their implants or removing their implants, what advice do you give them? Where do they start?
Yeah, I think, if we use that analogy like we did in the beginning, nobody really wants to come visit Rob in Austin and have surgery. So it's best to like silently stalk me. You can go to my YouTube channel, you can go to my podcast, you can listen to this podcast, and you just have to listen and learn as much as you can. And then for those patients who are interested in lowering their inflammation now, you can go to the website, drrobertwhitfield.com, fill out a little contact form, and they'll help you get into the system, not to have surgery, but to get opportunities to just lower your inflammation, either through support with supplementation, through our detox program, through testing. So we've opened all those things up to uh, everyone now in 2025, where you used to have to come in and have surgery with me to take advantage of those things.
That's amazing. That's an incredible service that you've given people. And so it obviously is not a decision that people should just make overnight. It's one that they need to do a lot of work through before they make this decision.
Yeah, and I'm glad you said work. So self-work is the most important thing. Like, I cannot, and I am not, I'll say this, y- this is not going to make anybody, from an aesthetic standpoint better. Like, you got the surgery to improve body aesthetics. This is not going to improve body aesthetics. So you have to be, from a support standpoint, working on yourself, and then making sure you have a good support system, either with a partner, spouse, family, friends, whatever that system is, because you're going to need help. And there will be times when you don't feel good or you don't feel like you look good. And that's not we get too caught up in the whole body image analysis by paralysis type phenomenon of this. I interview my patients on my podcast, and they talk about, how it was difficult to um, look in the mirror, or how it was difficult afterwards. And a couple of them have been very, very poignant about, you know, making sure that they tell themselves, hey, you know, I love myself. I love myself. And that's enough. And then it's always those patients who make those comments, but also have super supportive families and spouses and partners, and they do great. But you can imagine somebody who doesn't have that support, who gets caught up in a loop where they're really down about everything, and they already didn't feel well, and then now they do a surgery that is, once again, it's not an aesthetic surgery. It's not going to make anybody look aesthetically better. And I do a bunch of fat transfers. We didn't talk about that, but another way to get breast volume is to do a fat transfer, and we do them at the same time for as many patients as we can help with at the same time. But due to, findings of, you know, uh, in their workups, we selectively offer that. But that is something that's not talked about enough as a way to perform a breast augmentation, is using a fat transfer.
Okay, so that's different than what we were talking about earlier in the show.
Yeah. Yeah.
Okay, I didn't realize that. So, let's just touch upon it really quick.
Sure.
So, fat transfer is an option for people instead of the synthetic implants.
Yeah. So basically, if you think of the people who get implants, typically they're thinner people who didn't have a lot of breast tissue. So that's the reason they got an implant. And if you are someone who's a little bit heavier and has, fat, inner outer thighs, love handles, abdomen, whatever, you can take that fat and it can be placed back in the tissues beneath the skin, but above the breast tissue, to give volume back. So there are ways to do it. People have probably heard of the Brazilian butt lift. It's not different than that. It's just you can't put as much volume in the space between the skin and the breast tissue as you can between the skin and the butt muscle, because that's a bigger area, of course. So, of course, all these things are options if, in fact, you talk to somebody who knows how to do all those different things. So done thousands of fat transfers for cancer patients and cosmetic patients, just like I've done over 1,000 breast reconstructions and several thousand explants, because I'm old now.
Okay, but that's good to know that there's other options that they can do the
Yes.
fat transfers.
Yeah,
Um,
we're going to offer more and more fat transfers for patients. We've brought surgeons on to help with that, because I can't obviously do all those things, and do explants as well.
you see good success with the fat transfers?
Yeah, I think, the funny part was one of those patients I was talking to and interviewing, she about 10 years ago got on a very non-toxic lifestyle mission and started looking at critically all of their products and detergents and skincare, and making sure the water had a great filtration system at their home, and they were eating to the best, the highest quality foods they could source, and all the things. And I did her explant surgery and I did her fat transfer at the same time, and it was really interesting. Very quiet patient, recovered extremely well. But it makes sense because of how hard she works to do all the other things.
Mm, yeah.
And she had this toxicity test, and we do this on every patient. And she had none of the toxins that I normally see above the 75th percentile, meaning she has a very, very low tox burden, which makes sense because she is very careful about all these different things in her environment. And she's been doing it for a long period of time. Because when I interviewed her, I was like, when did you start doing this? She's like, all right, I started about 10 years ago, before I started having, children, because I wanted to have a, toxin-free environment for my children to the best of our ability. And I said, well, that's really, wow. That's very forward thinking at a time when it wasn't really that common. You're talking about 2014. Uh, if you would have asked me what a non-toxic lifestyle in 2014 was, I would have been like, what are you even talking about?
Okay, so one last question for you, and you touched upon it a little bit, but the majority of people that don't want an explant, I'm assuming don't want it because of how they will look, like you said, but then that causes that emotional um, aspect of this, meaning then they don't like how they look, which causes, this emotional challenge. And so, how do you guys help people with this emotional challenge, or what advice do you give to those that have had an explant that are dealing with this emotionally?
Yeah. So at every level of my organization, I have somebody who's had an explant who's part of the team. So my nurse practitioners have an explant. I have a patient concierge that's had an explant. We have my detox practitioner that's had an explant. So at each level of the organization, there's someone to talk with specifically about that. Because obviously, as a surgeon, I can't relate specifically to what's going on. And, you know, we try to, like, you got to meet people where they are, like you said. Like, some people are going to have a lot of challenges with it. And I don't want anybody to rush in after hearing this and go see plastic surgeon for an explant. There are a lot of steps to take to get yourself in both like the right mindset, I would say, where that's not going to be the main problem, which is what you're talking about. Is you have to get all the work done and feel comfortable with. Yeah, it's going to be a big body change. It's going to go back to potentially something they didn't really like beforehand, and they have to be comfortable with that. None of us can make anybody comfortable with that situation. That's something that they have to arrive at on their own.
Okay, good to know. I guess I do have one last question. Well, two last questions. So I'm curious, are you against implants in the first place?
No, implants, to me, were a tool I used in reconstructive surgery for cancer. So I don't feel like that is ever going to go away. So it makes no sense to, victimize an implant because I can tell you in my career, I've taken care of uh, hip implants, knee implants, spinal implants, cardiac implants. Oh my gosh, mesh implants from everybody who puts that stuff in that's gotten infected, and I've had to help them. So, the folks who are using implants typically are using it to help the patients, and nobody wants to have a problem with the outcome. I mean, things can get infected, things can, like we talked about, get biofilm. Nobody wants that to happen. So, the cancer patients probably are in the toughest situations. Um, So I used to convert a bunch of the cancer reconstructions with implants to that DIEP free flap reconstruction. And I knew those patients would do well because it was their own tissue. It wouldn't get rejected, provided all the steps went well and they healed. It would be in their favor. It'd be a very durable, long lasting, reconstruction for them. The same things hold true though. It's difficult to do those in the really, really thin patient. So then you're kind of stuck with, what do you offer those patients? Are you not going to offer them something because you're concerned with it? I think you have to explain everything carefully. Breast implant illness should be part of a discussion so that people understand that. And they have to make an informed decision. That's really all you can do to help the patients, is make sure that they understand all the pros and cons of what's about to go on. And then they have to decide, what they want to do.
Love that idea. Well, thank you so much for being here. I know my listeners have learned a lot because you actually answered a lot of questions that I get on a daily basis. And so I think you might have calmed a lot of fears because, like I said earlier, on social media, it just gets a frenzy almost, oh my gosh, I got to get them out. I got to get them out. And so I think you've done a great job calming people's fears and educating people on what they need to go do and to work on for themselves. So thank you for being here. Thank you for taking the time. I always close my podcast by asking my guests what they have found to be the best ingredient in life. What would you say it is?
Sleep.
That was a fast response. You had that one ready.
You got to sleep to recover.
And that's not even just after surgery. That's just on a daily basis we need to recover.
You prioritize sleep over everything else and you'll do better.
I love that. Simple, but so profound. Well, thank you again for being here. We really appreciate it.
Thank you for having me.
Thank you so much for listening. Remember to subscribe to the Just Ingredients podcast to learn more about your health and good ingredients to life. Plus, get daily tips at just.ingredients on Instagram.